Hi, I'm Danny, and I'm living with IgAN. So I have a big family. I have a twin and I have two half-sisters. I have like 30 cousins, and when we have family gatherings, there's probably 60 to 70 people there. It's a big ordeal. So when I first heard about my diagnosis, I was kind of in shock and honestly a little scared just for the fact that, I was 26 years old and the doctor's telling me that I have this rare disease. Just sitting there and having to think about what my future looked like. And, a full circle moment for me was having, my grandma there in person. She used to run a dialysis clinic for 25 years. And I could just tell, by her reaction that something was wrong and it was serious. Do you remember when you went with me to my initial diagnosis appointment with my doctor?
Yes, it was rough. I know when we come out on the porch, you wanted to know what it was, and I told you it wasn't as good as we wanted it to be. And it was very hard for me to talk to you, but when we first did it, I had to tell you so that we knew, but we had to be positive.
I really appreciate that. So I just want to tell you thank you. So the first thing I'd done after I received the diagnosis was try to follow up as quickly as possible and try to come up with a plan, because based on the first appointment, I knew kind of where I was at and we needed to get something going. The first treatment that I started was a high-dose steroid, and I was on that for well over a year. I knew the results were starting to get better, but my side effects were getting worse. So the thought of those two outweighing each other was getting difficult. I gained close to 60 pounds. I'm not a self-conscious person, but by the end, it was hard to look at myself in the mirror. So me and my doctor discussed when I was coming off of the steroid what options I had, and I pretty much told her that I did not want to go the steroid route. And so once FILSPARI became available, she gave me all the information and talked about the REMS program and everything that came with FILSPARI. And she did talk to me about the side effects of FILSPARI, and, we had discussed it, but it was something that I wanted to still pursue. So for me personally, I felt like FILSPARI was the right treatment for me because I didn't see it as another steroid. My grandma had talked about FILSPARI, and we talked about what she was thinking and I was thinking, and ultimately decided that I wanted to do it, and she fully supported me and thought that was the right choice for my next treatment option. My experience with the REMS program has been positive. I actually have comfort in knowing that by doing the test that it gives me and my doctor, lets her know that all my numbers and everything is correct. I'm just a fighter. I'm young, so I know I got a lot of life left, so I'm just trying to make the most of it and do what I have to do for my disease.
What is FILSPARI, sparsentan? FILSPARI is a prescription medicine used to slow kidney function decline in adults with a kidney disease called primary IgA nephropathy, IgAN, who are at risk for their disease getting worse. It is not known if FILSPARI is safe and effective in children with IgAN. Important safety information. What is the most important information I should know about FILSPARI? FILSPARI can cause serious side effects including liver problems and birth defects. FILSPARI can cause changes in liver tests. Liver failure was not observed in people treated with FILSPARI in clinical studies, but some medicines that are like FILSPARI have caused liver failure. Your healthcare provider will do blood tests to check your liver before starting FILSPARI, and then every 3 months during treatment. Your healthcare provider may temporarily stop or permanently stop treatment with FILSPARI if you have changes in your liver tests. Stop taking FILSPARI and get medical help right away if you develop any of the following signs of liver problems during treatment with FILSPARI: nausea or vomiting, pain on the upper right side of your stomach area, tiredness, loss of appetite, yellowing of the skin or the whites of your eyes, jaundice, dark tea-colored urine, fever, or itching. Because of the risk for liver problems, FILSPARI is only available through a restricted access program called the FILSPARI Risk Evaluation and Mitigation Strategy, REMS. Before you begin treatment with FILSPARI, your healthcare prescriber will explain the FILSPARI REMS. You must read and agree to all the requirements of the FILSPARI REMS. FILSPARI can cause serious birth defects if taken during pregnancy. Patients should not be pregnant when they start taking FILSPARI, become pregnant during treatment, or for 2 weeks after stopping treatment. Patients who can become pregnant should have a negative pregnancy test before starting FILSPARI. Patients who can become pregnant should use effective birth control before starting treatment with FILSPARI, during treatment with FILSPARI, and for 2 weeks after stopping FILSPARI because the medicine may still be in your body. Talk with your healthcare provider or gynecologist, a healthcare provider who specializes in reproduction, to find out about options for effective forms of birth control that you may use to prevent pregnancy during treatment with FILSPARI. If you decide that you want to change the form of birth control that you use, talk with your healthcare provider or gynecologist to be sure that you choose another effective form of birth control. Do not have unprotected sex. Talk to your healthcare provider or pharmacist right away if you have unprotected sex or if you think your birth control has failed. Your healthcare provider may talk with you about using emergency birth control. Tell your healthcare provider right away if you miss a menstrual period or think you may be pregnant. Who should not take FILSPARI? Do not take FILSPARI if you are pregnant, plan to become pregnant, or become pregnant during treatment with FILSPARI. FILSPARI may cause serious birth defects. Are taking an angiotensin receptor blocker, endothelin receptor antagonist, or aliskiren. Ask your healthcare provider or pharmacist if you are not sure if you take any of these medicines. Before taking FILSPARI, tell your healthcare provider about all of your medical conditions, including if you have liver problems, are pregnant or plan to become pregnant during FILSPARI treatment, or are breastfeeding or plan to breastfeed, as it is not known if FILSPARI passes into your breast milk. Do not breastfeed during FILSPARI treatment. Talk to your healthcare provider about the best way to feed your baby during FILSPARI treatment. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and grapefruit. FILSPARI and other medicines may affect each other and cause side effects. Do not start any new medicine until you check with your healthcare provider. Especially tell your healthcare provider if you take non-steroidal anti-inflammatory drugs, NSAIDs, potassium-containing medicines, potassium supplements, or salt substitutes containing potassium, blood pressure medicines. Ask your healthcare provider or pharmacist if you are not sure if you take one of these medicines. What are the possible side effects of FILSPARI? FILSPARI can cause serious side effects, including liver problems. C. What is the most important information I should know about FILSPARI? Serious birth defects. C. What is the most important information I should know about FILSPARI? Low blood pressure. This is common during treatment with FILSPARI and can also be serious. Tell your healthcare provider if you feel dizzy, lightheaded, or faint. Stay hydrated during treatment with FILSPARI. Worsening of kidney function. This is common during treatment with FILSPARI and can also be serious. Your healthcare provider will check your kidney function during treatment with FILSPARI. Increased potassium in your blood. This is common during treatment with FILSPARI and can also be serious. Your healthcare provider will check your potassium blood level during treatment with FILSPARI. Fluid retention. FILSPARI can cause your body to hold too much water. Tell your healthcare provider right away if you have any unusual weight gain or swelling of your ankles or legs. The most common side effects of FILSPARI also include swelling of the hands, legs, ankles, and feet, peripheral edema, dizziness, and low red blood cells, anemia. Your healthcare provider may change your dose, temporarily stop or permanently stop FILSPARI treatment if you develop side effects. These are not all the possible side effects of FILSPARI. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Travere Therapeutics at 1-877-659-5518. For additional important safety information, including serious side effects, please see the medication guide.